Hello, everyone. I'm Vanessa Grossel, Policy Analyst at the Council of State Governments. I serve as a staff liaison to CSG's Healthy States National Task Force, which is composed of 4 subcommittees examining such topics as capacity preparedness and resiliency, leveraging innovation, state health systems return on investment, and interventions to save lives. I'm joined today by Jennifer Gill, an emergency room nurse who also serves on the board of directors at the American Nurses Association as part of our Voices from the Front Lines series of conversations. Jennifer's longstanding commitment to leadership began when she was an undergraduate student at Villanova University, where she earned her Bachelor of Science in Nursing and was recognized as an international scholar, traveling to Peru and South Africa to provide nursing care to underserved populations. She moved to Boston after graduation and worked as a critical care and medical surgical charge nurse at Massachusetts General Hospital. While there, Jennifer was elected to serve on the American Nurses Association of Massachusetts Board of Directors and was active on the Health Policy Committee and remained committed to the professional development of direct care nurses and their involvement influencing healthcare, safe staffing, and health policy. And in 2019, she was elected to serve on the American Nurses Association Board of Directors, representing the voice of staff nurses, and was most recently appointed to serve on ANA's Political Action Committee, where she hopes to continue her work in advocacy and healthcare reform. Jennifer currently resides in New Jersey and is enrolled in the Nursing and Healthcare Administration Master's Program at the University of Pennsylvania. Her professional interests include understanding health economics, organizational dynamics, health policy, and addressing health disparities. Welcome, Jennifer.
Thank you. Thank you so much for having me.
Since the beginning of the COVID-19 pandemic and up until now, the top concern among nurses has been and still is access to sufficient personal protective equipment, or PPE. This has received substantial media attention, and we understand that the American Nurses Association has conducted surveys of the nation's nurses to get an accurate pulse on the pressing need for PPE. To date, ANA has heard from more than 46,000 nurses reflecting on their experiences from the front line. Can you tell us what the ANA has learned, Jennifer, and what has been your own experience?
Of course. In regard to PPE, one of the most important considerations we must understand is the variability of resources we are seeing from an urban, rural, and even similar facilities within the same city or state. With that said, the overall sentiment is quite similar. Nurses do not feel that they are receiving adequate protection. And so for our recent survey, which can be found on our website, 79% of registered nurses are encouraged and even in some cases required to use PPE. And 59% of those nurses felt unsafe with current practices. And so to me, that's a very outstanding number, but I'm unfortunately not surprised. Personally, I'm fortunate to work in an institution where I do feel supported. Our leadership is allocating resources appropriately and following best practice when it comes to PPE, but we're still being required to reuse our N95 masks for several days, which are initially made for single-use purposes. And so as cases rise, we must be mindful of next steps and what to do if resources are being stretched too thin. Even with those safeguards in place and proper use of PPE equipment, healthcare workers like myself are still at risk. I had all the support and still contracted COVID-19, unfortunately. And so for me, my ask for state government officials is for, that we need to have a coordinated response from all levels of government, starting from the state level, to ensure that nurses and providers have adequate PPE to properly care for their patients. Also, from an employer perspective, we need to have a plan in place to address any potential employee exposure, which includes rapid testing and treatment. And so, another recommendation for elected officials is to talk to direct care nurses about their work, especially those nurses who are in impacted areas, to understand the importance of having the highest level of protection and adequate PPE, and to develop a plan to support facilities in their communities and states.
All right. And the COVID-19 pandemic has taken a tremendous toll on the mental health of nurses and other healthcare workers as well. ANA has led a number of initiatives to mitigate the fallout and call for solutions to address the trauma, grief, and moral distress, as well as PTSD that nurses are experiencing and will struggle with even after this pandemic ends. What would you like state officials to know?
I think what I would like state officials to know is that the pandemic has placed an incredible toll on the emotional, physical, and mental health well-being of nurses and other healthcare providers. And as we see cases arise, these healthcare workers continue to display acts of bravery and compassion as we serve as our nation's first line defense to the COVID-19 pandemic. But unfortunately, this service has an immense personal impact on mental health. I mean, just speaking on personal experience, can you imagine placing you and your family's health in harm's way every day as you care for countless patients, at times colleagues, who have fallen victim of COVID-19? And so it's an incredible amount of pressure, it's an incredible amount of stress, but this is unfortunately our reality, and our reality that we're living every day. So as from a ANA perspective, we continue to receive stories from nurses who are working in the front line, and we are seeing an increased need for mental health services to address anxiety, depression, trauma, PTSD. And personally, for me, not having the normal support systems in place throughout the pandemic, such as my family, my church, due to social isolation, and feeling like I cannot be around others due to the nature of my work, has placed a significant toll on my well-being. And so I'm never really at ease. And nurses need to feel supported and valued so we can properly care for our patients. And so my ask for state officials and policymakers is to prioritize and sponsor mental health support legislation for nurses and all frontline healthcare workers. We need legislative action not only to support mental health services, but also to remove state regulatory barriers that are hindering qualified advanced practice registered nurses who are certified in this work and certified in mental health to work within their full scope of practice. We need more providers to do this work, and APRNs are qualified and vital members of the healthcare workforce.
Thank you for sharing that. The COVID-19 crisis has exposed longstanding health disparities across the country in different communities and along racial lines. Experts say these challenges among some African American, Latino, and other minority communities present obstacles in combating COVID-19. What does ANA recommend?
This is a very important question, and one that's very personal to me as a, ethnic minority nurse. And I know, from being a part of ANA, our organization is deeply concerned about the alarming reports of how the COVID-19 pandemic has disproportionately affected communities of color. We have seen the impact it has had also on the economically and geographically disadvantaged populations like our migrant farm workers and homeless individuals and immigrants. So for decades, we have unfortunately seen how social determinants of health and access to care have negatively impacted vulnerable populations. So this is why ANA supports a significant reinvestment in our nation's public health infrastructure and workforce, which have been unfortunately chronically underfunded for decades. A robust public health infrastructure and workforce better equips the nations with preparedness and response measures during times of crisis like the COVID-19 pandemic. However, this investment extends far beyond disaster preparedness and crisis management. Our healthcare workforce, of which public health nurses are actually the largest segment, touch every aspect of healthcare and community well-being. Nurses and advanced practice providers also play an integral role in narrowing these disparities. And so ANA calls on state government officials to collaborate with the CDC and HHS to collect and distribute this data on racial and ethnic disparities related to the coronavirus pandemic, but also for future public health emergencies. We also call on levels of government to support through financial backing and investment in our nation's public health infrastructure. Governors are uniquely positioned to maximize state resources and employing strategies to address ongoing public health demands. So this means optimizing resources in our communities of color and public school systems. And finally, I think we must advocate for a more diverse workforce in order to provide culturally competent care and address race-based implicit bias. Just as Congress authorizes Title VIII workforce development funds, we would like states to provide workforce diversity grants to increase opportunities for individuals who come from disadvantaged backgrounds, including students from, economically disadvantaged families, as well as underrepresented racial and ethnic minorities to enter the nursing profession. So this too is a true investment in our future.
And even as states reopen, we know that our world will never quite be the same after this COVID-19 pandemic. This global health crisis has exposed shortcomings in the healthcare system. And if we have learned anything during the COVID-19 pandemic, it's the pressing need to reimagine the healthcare system and healthcare delivery, from discovering alternatives to patient waiting rooms to more effective ways of triaging and treating patients. As a result, there have been discussions around the ability for nurses to practice optimally, consistent with their education and training. And given the need for more qualified nurses and health professionals to enter the workforce now more than ever, what recommendations does ANA have for reforming the healthcare system?
While the COVID-19 pandemic has exposed many shortcomings in the healthcare system, I would argue that it has highlighted our opportunity to work collaboratively to create innovative solutions that will improve access and quality of care. And as the largest segment of health professionals at 4 million registered nurses across the nation, and many of us work in almost every setting and sometimes assuming multiple roles. So my biggest ask of policymakers is to ensure that nurses are at the table to inform decisions about healthcare. It's absolutely crucial. We must also reflect and look at the barriers we've experienced throughout the pandemic, such as unnecessary regulations that hinder access to care. A very important factor to acknowledge is how telemedicine will continue to play a bigger role in managing infectious diseases in the future, including access to contact tracing technologies, virtual testing, and infectious diseases, but also, telemedicine. And so we must look beyond traditional avenues to address not only infectious diseases, but also chronic illness and how we can mitigate overutilization of our emergency rooms and access care and acute care facilities. Healthcare costs have been, for a long time now, have been exacerbated in our country. And so as we look to the future, we must do a better job in utilizing our resources appropriately. Which brings me back to the need for APRNs to be granted full authority of their practice, consistent with their education and training. And we must address the gaps in our healthcare system by optimizing our supply of healthcare providers. And so this should be reflective in our payment models and further supported in legislation across all 50 states. Ultimately, a strong healthcare infrastructure attracts businesses, education, and families to communities. And so a vibrant economy requires access to providers within that community. My last message is simple. Nurses are ready to partner with you to create long-lasting solutions for generations to come.
Thank you, Jennifer, for joining us today. We appreciate you for making time during this extremely busy and challenging time to share your expertise, which will greatly help to inform the work of our task force as we move forward. I'm Vanessa Grossel at CSG headquarters in Lexington, Kentucky, and I've been speaking with Jennifer Gill, who serves on the American Nurses Association Board of Directors and also works in the ER in a hospital in Philadelphia. Thank you so much.